Good evening, and welcome to our panel on increasing the resilience of health systems and improving states' rapid response capacity. I'm Dr. Jennifer Lee, a Washington, D.C.-based emergency physician. I'm a visiting scholar with the National Academy of Medicine and have served as a medical analyst for CNN during this pandemic. It's my honor to be your moderator for this panel tonight. In this panel, we will focus our discussion on how to increase the resilience of health systems in the context of the COVID-19 pandemic. The novel coronavirus has been the ultimate stress test on our healthcare systems, as well as our economy, government, and schools. We have seen weaknesses in the public health system magnified under the strain of the pandemic, and we have also witnessed unexpected strength and fortitude, innovation, and collaboration in the fight against the virus. We are still very much, of course, in the middle of the pandemic, especially with over 700,000 new cases last week in Europe, the highest weekly total so far, according to the WHO. The situation in Romania is similar, with a total of over 20,800 new coronavirus cases in the last 7 days, an increase of nearly 50% compared to the previous week. Now is exactly the time to examine what we are seeing and learning through this pain and hardship of the pandemic. What public health policies need to be reformed urgently to ensure that all patients can receive critical medical services they need and gain access to the vaccine when it's ready? How do we address the weaknesses that have been revealed and leverage the strengths of our system to not only endure and overcome this crisis, but to be better prepared for others that will inevitably come in the future? These are some of the topics we will address in this panel. We're delighted to have a very distinguished group of speakers with us today to explore this important issue of health system resilience in the midst of the pandemic. I'd like to introduce our first. Ms. Carmen Mihălcescu is the Vice President of the Romanian Chamber of Deputies. Ms. Mihălcescu is a lawyer who has served as the Vice President of the Permanent Bureau of the Chamber since 2017. She has had a long and illustrious political career in the Chamber of Deputies, first elected in 2000 as a member of the Social Democratic Party. In the Chamber of Deputies, she has served on many different committees, including the Committee on Legal Affairs, Discipline, and Immunities, the Committee of Equal Opportunities for Women and Men, the Committee of Culture, Arts, and the Media, the Commission for Public Administration and Territorial Planning, the Legal Discipline and Immunities Commission, and the Commission for Foreign Policy. More recently, and especially relevant to our panel topic today, she's also a member of the Working Group on Fighting Cancer in the Romanian Parliament. Unfortunately, Ms. Mihălcescu was unable to join us today live for the panel, but sends her regrets as well as her recorded remarks that she wished to share with us.
Distinguished guests, it's my honor to have the opportunity to address a few words during this year's Bucharest Forum dedicated to a matter of major importance worldwide. We are crossing some challenging times, not only as individuals but as administrations. Promoting and supporting the well-being of our citizens represents a fundamental pillar to the state of the nation and a priority for the Parliament of Romania. It's in our responsibility to develop and deliver smart solutions in response to COVID-19 reality, as we are in the front row of the decision-making process. Perhaps no other crisis has shown better how important a strong and well-equipped state is in facing with a major problem. I hope that we have all learned this lesson. In the future, we'll know how to make better choices in terms of our assurance in the face of challenges. I can assure you that the Parliament is not and will not remain silent in front of this new coronavirus that is threatening the health, education, and economical stability of every Romanian citizen and all other residents and investors living and working on our grounds. The ultimate goal of the fight against COVID is to save as many lives possible and to stop the fast spread we currently face. It's critical for the politicians elected in the front row of the country to share a common view of this new reality and to ensure equal distribution of wealth, health measures and financial instruments to every Romanian. The Parliament of Romania will remain focused on monitoring that all public instruments used in fighting this pandemic are effectively implemented. It's in our hands to make sure no one is left behind. Thank you very much. God bless you.
Thank you, Vice President Mihălcescu, for your remarks. And now what I'll do is introduce each of our three panelists today and turn to them respectively for some opening remarks before we get into the panel discussion. So first, we are very honored to have with us today Dr. Hans Kluge, the WHO Regional Director for Europe. Dr. Kluge began his term as WHO Regional Director in February of 2020. Dr. Kluge has 25 years of experience in medical practice and public health in numerous settings around the world. He is originally from Belgium and began his career as a family physician there, and then went on assignment with Médecins Sans Frontières, responding to emergencies in Somalia and Liberia, and coordinating tuberculosis control programs in conflict zones. He worked on TB control in the prisons of Siberia and was a regional TB advisor to former Soviet Union countries. In 1999, Dr. Kluge joined WHO as TB and HIV project manager at the WHO office in the Russian Federation. Later, his work expanded to both HIV and malaria, supporting the office in Myanmar, as well as being a consultant on TB to the Democratic People's Republic of Korea. In 2009, Dr. Kluge moved to the WHO regional office in Europe, and the following year was appointed Director of the Division of Health Systems and Public Health and Special Representative to combat multi-drug-resistant TB. As Division Director, he led the development of a new WHO European vision on health systems for prosperity and solidarity, and drove work on a regional study on universal health coverage and financial protection. Throughout his career, as you can see, Dr. Kluge has always been committed to achieving better health for all, with a focus on the vulnerable. As Regional Director, his vision for the WHO European region is united action for better health, and working in partnership to achieve universal health coverage, address health emergencies, and promote healthier populations. Dr. Kluge, it is an honor to have you join us today. We now turn to you for your opening remarks.
Thank you so much, Jennifer. Good afternoon, everyone. Today, as we meet, we are still very much in the midst of this pandemic. This forum, therefore, is an important opportunity to explore COVID-19 through a wider lens so that we can better respond to the immediate needs and in the long term. Today's discussion comes at a time when whole our region is grappling with a surge in COVID-19 cases. And although we have become more sophisticated in our understanding of how to manage transmission in our communities, the weaknesses in our health systems and our emergency response capacity have been bluntly revealed. As we reckon with the true impact of the pandemic, we face a unique opportunity to rapidly pioneer and implement strategies that are going to enable us ensuring greater resilience in the future and deliver on responsibilities to our citizens when it comes to health and well-being. For WHO Europe, these strategies fall along three strands. First, efforts to build stronger health systems. Second, improvements in our region's emergency response and preparedness capacity. And third, pioneering of new approaches. These trends have been operationalized in our European program of work, our agenda for health for the next 5 years. This EPW combines a commitment to leaving no one behind through universal health coverage and advocating for health to be prioritized on the public policy agenda. And to achieve this, the agenda prioritizes 4 flagship initiatives: mental health, digitalization, immunization, and behavioral insights to accelerate progress and drive resilience building efforts. Our first strategy: concrete action that will build resilient health systems. The pandemic has forced our health system to adjust with unprecedented speed. And central to this effort was our health workforce, our heroes. And we must first and foremost prioritize their well-being, including providing adequate mental, physical, and financial support. If we do not care for them, we will have no health system to talk about. For primary healthcare, we have learned that these systems needed to operate a dual-track service delivery, where traditional primary healthcare services are provided in parallel to services focused on the pandemic response. And if we are to enable the dual-track capacity in the future, adequate resourcing and stronger referral mechanisms are vital. For us to enable health systems to respond in the way we need, we also must take advantage of alternative service delivery platforms. The new frontier of digital and remote services should be scaled up to reduce barriers to seeking care. For health systems to be resilient to shocks, they must have strong governance structures driven by strong leadership. And these structures will support the health system preparedness in the face of rapid changing scenarios. The second strand focuses on ensuring every country in our region has adequate emergency response capacity. And as we continue to grapple with the biggest health emergency of our time, we are pushed to rapidly rethink and reshape the way we are set up to respond to emergencies. Even prior to COVID-19, there was consensus that the world was not prepared for global health threats. And as COVID-19 spread, the preparedness gaps in countries have been exposed, and yet many countries have made substantial progress in developing effective level of disease detection with surveillance and laboratory capacities. The application of lessons learned from previous infectious disease emergencies have helped to strengthen the country's capacities to detect and verify suspect cases. Right now, WHO is working with countries to assess their COVID-19 responses through intra-action reviews. Finally, and perhaps most strikingly, is the opportunity to pioneer new approaches to persistent and growing challenges. Because the COVID-19 has shown us that we need an integrated cross-sectoral approach if we are going to achieve the structural change to protect our communities. In order to elevate health and social care as a societal and political priority, I have established the Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, to rethink on society and investments in health and social care at the highest level possible to leave no one behind and build the capacity of our health system. Dear colleagues, it's a great honor for me to be part of this panel, and thank you to you, Jennifer. Thank you to my respected panel members. Thank you.
Thank you very much, Dr. Kluge, for your remarks, and we look forward to the discussion. Next, I would like to introduce our honored guest, State Secretary of the Ministry of Health in Romania, Dr. Dragoș Garofil, a highly trained physician and surgeon who previously served as assistant professor on the faculty of the prestigious University of Medicine and Pharmacy, Carol Davila in Bucharest. State Secretary Garofil, any opening remarks?
Thank you. It's an honor to be invited in this panel alongside Professor Hans Kluge and also Professor Alexandru Rafila, two professionists that are really involved in the management of this pandemic both at European level and in Romania. We live very hard times. Today in Romania we have a record of new cases, over 4,000 cases, and also almost 2/3 of our dedicated COVID ICU beds are full with patients. So we are at a turning point, I must say, in the evolution of the pandemic in Romania. Till now, we managed to not to cross the red line of the health system capacity to treat the COVID patients, but now we are at a dangerous point, and unless we take some action, we are in danger of crossing that red line. So I want to thank for this opportunity to debate on this subject. It's very important to know and to discuss these topics. We all have to gain from the experience of our colleagues in other countries. So looking forward for the debate. Thank you.
Thank you, State Secretary Garofil. And our third speaker is Professor and Dr. Alexandru Rafila, who is the Director of the Healthcare and Quality of Life Program in the Aspen Institute, Romania. He is also a member of the Executive Committee of the WHO. If I were to share with you Professor Rafila's bio and accomplishments, it would probably take the rest of our time together. So with his permission, let me just say that he is highly esteemed as a health policy leader, as scientist and physician in Romania, as well as being recognized by the WHO, NATO, and the European Commission, and has held numerous leadership positions in the central administration in Romania, including as being a direct advisor to the Minister of Health, Secretary of State for Medical Assistance and Public Health, and prior director of the Public Health Institute of Bucharest. Thank you, Professor Rafila.
Thank you, Dr. Lee, for introducing me. I am glad to be together with very good friends. I want to say hello to our regional director, Dr. Hans Kluge, which is not only my friend, it's a friend of Romania, and that's very important because he knows very well the Romanian health system, and all the times we asked, he offered his technical advice, and he helped us to change the vision regarding the leadership regarding the vision of the development of Romanian health system. And also I want to say hello to my colleague, Secretary of State, Dragoș Garofil. And I should say, because no one hears us, that in my opinion is the most, not only the most ambitious, but the most dedicated person working in the Ministry of Health during this pandemic. So the idea of having this debate on the resilience of the health system during the pandemic, I think it's very actual. And you see things are changing, because at the beginning of this pandemic, we saw Romania, we saw other countries on the eastern part of Europe having better results if we compare with Western Europe, less cases, less deaths, and we can say that during the spring, the eastern part of Europe, the evolution of this pandemic was under control, excepting at the beginning when the lack of personal protection equipment was evident, but this was in many countries. The preparedness and response was quite weak, and countries at the global level were not prepared, with some exception, of course, to develop pandemic preparedness plans, as WHO has requested and countries have agreed during the World Health Assembly in 2018. So now the things change. We saw a lot of cases in the eastern part of Europe. We see a lot of cases in the western part of Europe, but at the end, it's important the capacity of the health system to respond to these challenges. And we see a big difference in terms of mortality, in terms of transmission rate between countries. And I think we can learn one from other. And what is very important is partnership during these times during countries. And I think WHO and the WHO European Office for Europe have a tremendous task to give best advices to European countries to keep this global public health problem under control. Thank you, and I'm ready to share with you other opinions in the near next minutes.
Thank you so much, Professor Afila. So we heard from Dr. Kluge earlier some strategies for the European region on how to strengthen their health systems. I'd like to start with you, State Secretary Garofil, if I could, to ask a question about how do we ensure that we do not lose focus on caring for patients with chronic diseases, even as we are trying to address the immediate threat of COVID-19. I know that in Romania, as in many nations, we've seen a decrease in both inpatient and hospital admissions as well as outpatient services. And certainly that is having an effect on people who need to access care. How do we balance those two needs?
Well, I think this is the most difficult aspect in dealing with the pandemic, to find this balance, and many countries struggle with it. Romania also. Fighting COVID shows that the other pathologies are not being addressed as properly. We record a down size in admittance, in hospital admittance, in surgical procedures. So it's clear that the pandemic affects the treatment of chronic patients in Romania quite significantly. There's a double setback. One is the reluctance of chronic patients to address the hospitals. They are afraid to go to hospitals and stay at home, and their chronic diseases get worse and worse, and they go to the hospital in advanced stages, and also a reluctance from the health personnel, from the doctors, that are afraid, we can say afraid, to admit patients without without testing. Now most patients admitted are tested for COVID before admittance, but this is a laborious procedure, takes time, and the hospitals have waiting some dedicated zones for these patients that wait for their result. These places are getting full, and patients have to wait for their turn to be admitted. So it's very difficult right now to address this problem. We're trying hard. Romania has a hospital-oriented health system, This is one of the good things, that the number of hospital beds per capita in Romania is quite high. It's one of the highest in Europe. We try to, and still try to keep clean hospitals. So we have dedicated COVID hospitals and also non-COVID hospitals. These things also kept us from having from mixing patients with COVID with non-COVID. The infrastructure in Romania is very old, so the hospitals are. It's very difficult for the hospitals to provide with separate circuits for COVID and non-COVID. So that's why we decided to dedicate COVID hospitals and non-COVID hospitals, because mixing patients would have been a failure in Romania due to the poor and old hospital infrastructure. We tried to take this weakness, this bad infrastructures that we have, and turn it into our advantage. Also using the pavillionary hospitals that are much easier to dedicate to COVID, and not to mix patients and risk infecting. This is the challenge for the future. As the number of new cases increases, it's clear that more and more hospital beds will be focused on COVID, and this is detrimental to non-COVID. Right now, we are trying to switch from hospital admittance to treating the pre-symptomatic, asymptomatic, and the easier we want to treat these patients in ambulatory care at home. Till now, every COVID patient was admitted to hospital or evaluated in a hospital, but it's clear right now that the high number of cases will make it impossible. So this is the biggest challenge we face right now, to try to move and to treat the patients in pre-hospital. So unfortunately, our ambulatory infrastructure is very poor, much underfinanced. As I told you, our system being hospital-oriented for more than 30 years now. So this is our biggest challenge right now.
Indeed, many challenges. Thank you, State Secretary Garofil, for describing how you're approaching some of those in Romania. I'd like to go to Dr. Kluge to also reflect a bit on this challenge of meeting the acute needs of patients with COVID, but also not neglecting the needs of those with many chronic conditions.
Right. Thank you, Jennifer. And thank you very much, Mr. State Secretary, for sharing the insights in Romania. I found it very sharp, a very good analysis, which is unfortunately, not only for Romania, but we see it across the region. I would say that this is one of the lessons that we learned from the so-called first wave. And this is the question that I'm being asked several times a day by the media is Europe going to go to another European national lockdown? And it has to do with this point that whatever the situation is, and of course a national lockdown should only be a last resort really, for one of the reasons is this one, that the other patients suffered a lot. And ultimately, we only have a certain number of doctors, nurses, midwives, social care workers, which are at the edge of being burned out, because this has been 24/7 since the start of the pandemic. And now we see the number of daily cases 2 to 3 times higher than in the peak of April. So in that sense, I fully agree it's a concern, and we are making a case at WHO to go back to the basics, which means in 1978, the countries globally adopted the Alma Ata Declaration on Primary Healthcare, where many of those issues are coming together. And we saw this in a number of countries, like Austria, for example, that when the COVID was kept out of the hospital and managed in primary healthcare or somehow in between, that it was easier somehow to deal with this double disease burden. But I'm definitely very concerned, for example, also in interruption of screening of cancer. We know that in some countries, the mortality for breast cancer will go up with 10%, the mortality of colon cancer to 17%, due to interruption of the cancer screening, and those deaths should have been avoided. And we see it in other disease events as well. Thank you.
Thank you, Dr. Kluge. Professor Afila, Dr. Kluge talked about getting back to the basics, which makes very good common sense. In Romania, do you have concerns though about certain segments of the population who maybe never had good access to the basic healthcare, cancer prevention and screening, and maybe are suffering even more right now? What do we do to address care and access for those vulnerable populations in Romania?
Okay, thank you for our question. Regarding the access to preventive health services in general, it's a challenge for Romanian health system because normally the primary health care should be involved more deeply in these kind of activities, but until now, as already mentioned Secretary of State Garofil, our health system is more hospital oriented, which is not an approach, which is not a sustainable approach regarding the access to health services. The development of the primary health care network, it's one of the key issues for the Romanian health system, and I think is the response, especially for neglected or vulnerable population group, in order to access health services easier. Development of the platforms of e-health technologies and procedure may be accessible to people which are isolated, which are poor or have poor education, only if we'll succeed to develop this infrastructure of primary health services and, of course, ambulatory specialized care. And regarding the prevention programs, and I will mention one of the programs I know very well, the cervical cancer screening, and we have here a big challenge because Romania is one of the leading countries in terms of morbidity and mortality due to the cervical cancer, or also breast cancer. It's one of the problem of the system, and improvement in this area, it's needed through wider screening access for women, and of course what we have as specific tool, vaccination against HPV, which is now accessible to Romanian girls, And this kind of public health policy oriented on prevention and improving access to health services, especially at primary level, in my opinion, is the only response we can give, because if we'll concentrate all our resources on hospital, will be very difficult to address, and of course, no one on this earth have resources to increase only the hospital-based care and not to develop primary health care. Primary health care is the answer, including in WHO strategy regarding universal health coverage, is the answer for those groups you mentioned in your question.
Thank you, Professor Afila. I think we're hearing some common themes here that focus on more ambulatory services, primary preventive care, and the critical need for the workforce to support those aspects, those services as well. In the 5 remaining minutes that we have left, I would just like to go across the panel and ask what is the best strategy to really address the workforce needs and that shift from inpatient to ambulatory and outpatient in Romania. And Dr. Kluge, if we could start with you, and any recommendations. I'm sure that Romania is not the only country that is dealing with this need to rebalance services. Any recommendations for them as they work to build a stronger system?
Right. So indeed, Jennifer, I would like to speak, let's say, at a European level, because I feel very humble next to great specialists like State Secretary and Professor Afila. But absolutely, it is not only for Romania. I think first and foremost is the recognition and the prestige that we have to agree that primary healthcare is not poor care for the poor people. The prestige of the primary healthcare system, the community care, has to be elevated, but also financially well compensated, and there can be different incentive mechanisms like career path and other issues. Professor Afila was speaking very well about some certain rural areas for vulnerable groups. One of the proven strategies has been to try to recruit professionals from those communities. And Romania has been doing this, very, very well. Romania, let's not forget that has been very innovative in addressing the needs of vulnerable people. But the issue now, I believe, like in many countries, is to scale it up. It's not enough to have the innovative project. It needs a transformative push to scale it up. And that has to do then with the necessary political commitment and legislative changes. Thank you.
Thank you. State Secretary Garofil?
I think the health services pyramid has been an objective of ours in the previous strategy from 2014 to 2020. Unfortunately, the results are very, very poor. During these years, we we financed only the hospitals, and the primary and ambulatory care remained still underfinanced, still underdeveloped. Inverting the pyramid requires a paradigm shift in Romania. As Dr. Kluge said, it's a matter of prestige, it's a matter of trust from the patient in the first. So the patients in Romania put their trust in the doctors in the hospitals mainly, and do not address with confidence the primary care and the ambulatory care. So this is the main problem, but this paradigm shift won't be able to be addressed until we address the other problems. First of all, we need to address the infrastructure of the ambulatory and the primary care. and the extension of the services they provide. For 30 years now, these two levels of care have been underfinanced, underdeveloped. In the rural area, there are only 22 ambulatory facilities in the whole country. In total, we have more hospitals than ambulatory facilities, specialized ambulatories. You know, so this infrastructure doesn't give a chance to the patients from the rural area who have to go to the cities to find the ambulatory services they need, and to go back to the village they come from is very difficult. The transport infrastructure is also poor, so it's much easier for the patient from the rural area to get admitted in a hospital, stay there, and get the necessary treatment. So he is not incentivized at all by this lack of infrastructure. So unless we develop the infrastructure, the patient won't be incentivized to address the primary and ambulatory care. Then it's a matter of the hospital incentives, because now with the financing system of the hospitals incentivize the hospital management and the doctors from the hospital to admit as many patients as possible. We pay very little for a case, so there is a cap on hospital admittance that the hospital required to get in order for them to survive. So if they don't admit many patients to reach this cap, they cannot pay their salaries, they cannot survive, because the tariff is so low on one patient. So we have to modify this way of financing the hospital, and we should pay adequately for a case in order to that the hospital won't be incentivized to admit unnecessary patients. There's another problem that I'm reluctant to address, but in Romania there is still a phenomenon of informal payments that are at the root of all evils, that incentivize the hospital doctors to admit patients. So these issues should be addressed first in order for the patient to get the confidence to address the primary and the ambulatory care, instead of the hospital care that is much more expensive, and it's unsustainable, as Professor Rafila said, for a poor country like Romania, poor in terms of health system, of total health expenditure. I mean, Romania has a total health expenditure of 13 billion euros at a population of 20 million, comparing to Germany, for example, with 360 billion at a population of 18 million. So it's
Wow.
7 times less the financing, and this is a very big problem that only in some years can be obtained. You know, so it's not something that we will be able to do overnight, because it requires a real paradigm shift and big reforms in all the levels of healthcare.
Absolutely. Those are some major challenges that you've laid out: infrastructure, the financing system. as well as changing the overall culture, the prestige, the perception of primary care and ambulatory services. So, and unfortunately, we are about out of time. If Professor Rafila, if you have any closing comments in the last 30 seconds, I can turn to you.
First, thank you to all of you for joining our session in Bucharest Forum 2020. I think the most challenging is changing mentality, because if we'll succeed to change mentality, we can think to solve the problems of the public health system. And I want to comment, the primary health care is not a matter only of prestige, it's a matter of trust, and it's a matter of accessibility. And if we'll succeed to address these three challenges, I think the primary health care can bring a hope for the future of the access of Romanian people to health services, to reach the universal health coverage until 2030. Thank you.
Thank you so much, Professor Rafila. Thank you to all of our distinguished guests on this panel. We not only appreciate your time this evening, but your leadership and your dedication during this difficult time. Again, thank you.